We are now moving on to health and care worker visa section. Unfortunately, health and care worker salary threshold has also increased. It is now 29,000 for occupations that are not on a national pay scale. So, for instance, professions such as public health managers or healthcare practice managers are now required to be paid the minimum salary threshold of 29,000. This is also classified as option F. The next option K concerns the jobs on national pay scale for which the minimum salary paid is 23,200 or the full going rate. So some examples of the jobs on national pay scale are physiotherapists, occupational therapists, psychologists, and registered nurses. Immigration salary list has also reduced the jobs that were previously available under the health and care worker route to only 4 professions. You can see them on the screen. It's laboratory technicians, strictly those professions that require at least 3-year experience, pharmaceutical technicians, and of course, care workers and senior care workers. So for these 4 professions in this immigration salary list, the minimum salary is 23,200, except for the pharmaceutical technicians, for which the minimum salary is 23,400. Specific restrictions have been imposed on sponsors who are employing care workers or senior care workers. So due to the changes that happened on the 11th of March 2024, those sponsors who are wishing to employ new workers in these occupations, they must be registered with the Care Quality Commission or the CQC. And in addition to being registered, they must also carry out activities regulated by the CQC, and they must not be dormant on the register. However, the good news is that for those employers who have been employing workers under these routes and they continue to sponsor them, there is no requirement of the registration with the CQC, and their employees can extend their visas provided that they are continue to be employed by the same sponsors and they work in the same occupation. Those care workers, senior care workers who wish to switch to another employer, they can only now do so if that employer is registered with the Care Quality Commission. On top of all of this, sponsors are also required to provide additional information when they assign a certificate of sponsorship to the new care workers or request a defined certificate of sponsorship. And this additional information is to confirm their CQC registration and also additional information about work location. So where the sponsors are planning to employ these care workers. Unfortunately, care workers who have obtained their permissions after the 11th of March are no longer able to bring their dependents. All care workers and senior care workers already on the route are still able to bring their dependents if they are still employed with the same sponsor and they continue to be employed in their roles and they're not changing to a different occupation.